While Prime Minister Justin Trudeau and his federal Liberal caucus met in St. Andrews this month, advocates and healthcare workers held a rally nearby. They included members of the Canadian Health Coalition and Canadian Union of Public Employees, which includes frontline healthcare workers. They were there to send a message to the federal and provincial governments on the decline in public healthcare. The rally received honks of support from drivers, including from workers transporting hospital linens. The event came amid an ongoing crisis in the healthcare sector marked by a lack of nurses and other healthcare professionals. Earlier this month, the CBC reported that a pregnant woman was turned away from the Chalmers Hospital following an alleged sexual assault. The 26-year-old woman was reportedly told that she would have to return the following day because no sexual assault nurse examiners were available. Here's Prime Minister Justin Trudeau responding to a question from a journalist about that incident.
No, I heard of that story, and it's horrific. It's unacceptable that a survivor be faced with that kind of response. We know how challenging it is in some cases to deal with institutions, whether it's hospitals or police, after that kind of violence. And my heart goes out to her and to the entire community that's supporting her. Obviously, every Canadian knows that our healthcare system is under tremendous stress right across the country.
Last month, Premier Blaine Hicks said all options are on the table for the healthcare system, including more private delivery of services. But that's the wrong approach, according to public healthcare advocates like Steve Drost, the president of CUPE New Brunswick. Here he's speaking to Wayne Long, the federal Liberal Party MP for St. John Rothsay at the rally.
We're asking all politicians to do everything they can to save our healthcare system. Like you stated at the very beginning, we can't afford a two-tier system, and we cannot afford any privatization of healthcare services. Thank you for coming to see us.
And I agree with you. And I mean, I would never divulge caucus confidentiality, but certainly just talking to my colleagues and MPs, everyone sees with it. We all see what's happening, and we have some major challenges in healthcare and housing, affordability, and many things as a country. So, the more we stand up and address those and address them head on, the better off we're going to be.
Well, we knew you were down here, discussing the top of your agenda was affordability, and we can't afford to privatize health.
The NB Media Co-op also spoke to advocates, including Sharon Thier, president of the New Brunswick Council of Nursing Home Unions.
Well, I will tell you, in nursing homes, the exhaustion, the physical and mental fatigue is wearing on those who are currently in the system to the point that the staffing crisis, you will actually see one worker to 19 residents on a daily basis. Some nursing homes are being scheduled 5 to 7 short. That's not including any emergency calls that may be called in for that day.
What should the province or the federal government should do, like hiring more nurses or increasing their wages? Like, what do you think the government should do?
Well, I think it's not just a single step solution. This crisis didn't happen overnight, so I think it's going to take multiple levels of governments to actually address this issue. As well as to bring all stakeholders to the table. That's frontline workers, that's governments responsible for the portfolios, and to hear some of the recommendations that are brought forward. And I do believe that collectively together, if we don't eliminate the frontline workers and their voice on some of the resolutions, then we could, on a short term, but then look at a long-term plan to address the current crisis.
We, of course, are very concerned about the current cutbacks that we're seeing. Specifically, we've heard about down in Sussex, the emergency room having to close in the evenings. And Premier Higgs is just talking about privatizing the healthcare system. And we came out here today to call upon the federal Liberals to say no, enough is enough. This cannot continue. We need to be investing in a public health care with union workers and in making sure that our health care does not become profit care. And that's why we've came out today. We've started a petition saying that we want to invest in health care, not Higgs care. And that's why we came out today, and to support the other groups and all New Brunswicks only Brunswickers, who are very concerned. I constantly get calls at my office. You know, the wait times for ambulances and emergency rooms, people literally dying, waiting to see someone. This cannot continue. And we need to be investing in our healthcare.
There's no room for privatization in our healthcare system. What we need to do is be attacking the excessive greed of the corporations and actually investing in our public services. Public healthcare, but right across the board. We should have better education, better hospitals, but our citizens of this country, they deserve to have good quality public services, and there's just simply no room for corporate greed and profit to come out of our tax dollars.
For the NB Media Co-op, this is Arun Budathoki.